12 bad habits that damage your kidneys. Hey there, folks. We all know the importance of maintaining good health, but sometimes we unknowingly indulge in habits that can harm our precious organs. One such vital organ is our kidneys. These bean-shaped buddies play a crucial role in filtering toxins from our blood, maintaining our body's fluid balance, and regulating blood pressure. To help you keep your kidneys in tip-top shape, let's delve into the 12 bad habits that could be silently damaging these vital organs. 1. Excessive salt consumption. You might love that extra dash of salt on your fries, but your kidneys might not share the enthusiasm. Too much salt can lead to high blood pressure, causing damage to your kidneys over time. Aim to cut down on the salt shaker and check food labels for sneaky sodium content. A high salt intake has been shown to increase the amount of protein in the urine, which is a major risk factor for the decline of kidney function. There is also increasing evidence that a high salt intake may increase deterioration of kidney disease in people already suffering from kidney problems. How to limit salt intake. Limiting your salt intake can play a huge role in maintaining kidney health. Here are some ways to reduce your daily salt intake. Read food labels and compare sodium levels to different products. Avoid cured, salted, smoked, and other processed meats such as ham, bacon, and cold cuts. Select whole, unprocessed foods. Choose packaged foods labeled low sodium, reduced sodium, or no salt added. Use alternatives to salt when cooking, such as fresh herbs and spices like basil, cilantro, cardamom, caraway, curry, ginger, rosemary, thyme, dill, sage, and tarragon. Eat more fresh fruits and vegetables. Limit your consumption of sauces, mixes, and instant products. Check the serving size on food labels. 2. Inadequate hydration. Do you sometimes forget to drink enough water during the day? Well, your kidneys won't thank you for it. Staying hydrated helps them flush out waste and toxins efficiently. So make sure you keep that water bottle handy and sip your way to kidney health. Water helps remove wastes from your blood in the form of urine. Water also helps keep your blood vessels open so that blood with important nutrients can travel freely to your kidneys. But if you become dehydrated, then it's harder for this delivery system to work. Mild dehydration can make you feel tired, and it can also impair normal body functions. Severe dehydration can lead to kidney damage, so it's important to drink enough when you work or exercise very hard, and especially in warm and humid weather. Some studies have shown that frequent dehydration, even if it's mild, may lead to permanent kidney damage. You can get a rough idea about how well you're hydrated by looking at your urine. If it's a very dark yellow, that may mean you may need more water. But if it's always very dark, then you should check with your healthcare professional to see if something like a certain drug is changing the color of your urine and not your hydration status. There is no set rule about the amount of water everyone should drink. We all have different needs for water depending on differences in age, climate, exercise intensity, as well as states of pregnancy, breastfeeding, and illness. If you have kidney failure or low kidney function, then you may need to restrict your water and fluid intake. All questions and concerns about dehydration and water intake should be discussed with your healthcare professional. 3. Excessive sugar intake. Sugar may make your taste buds dance, but it can also put a damper on your kidneys. High sugar diets can lead to diabetes and obesity, both of which are kidney troublemakers. Keep an eye out for hidden sugars in packaged foods and try to limit sugary treats. Sugar is not a problem for the kidneys unless your blood sugar level gets too high. This commonly occurs in both type 1 and type 2 diabetes. Once the blood sugar level gets higher than 180 milligrams per deciliter, (mdl), the kidneys start to spill sugar into the urine. The higher the blood sugar, the more sugar comes out in the urine. If your kidneys are normal, this usually isn't a problem, but if you have diabetes, too much sugar can cause kidney damage. A common blood test used to detect diabetes and monitor blood sugar levels over time involves the hemoglobin A1C HbA1c protein. The higher the blood sugar gets, the more sugar gets attached to this protein. Determining the levels of hemoglobin A1c helps to give an estimate of the average sugar level in the blood for the past 3 months and provides an indication of how much damage the sugar may be causing in the body, including to the kidneys. A normal HbA1c is less than 6% for someone who doesn't have diabetes. As the HbA1c gets higher, more damage is done. Uncontrolled diabetes can damage the blood vessels of the kidneys and destroy their filters. When the blood vessels in the kidneys are injured, the kidneys can't clean the blood properly, resulting in more water and salt being retained and waste materials building up in the blood. 4. Overuse of painkillers. Got a headache? Reaching for painkillers regularly might be convenient, but it's not kidney-friendly. Habit. These medications can strain your kidneys. Consider alternative pain management strategies and consult your doctor when needed. What analgesics are safe for people who have kidney disease? Acetaminophen is the drug often recommended for occasional use in patients with kidney disease. But everyone with kidney disease should rely on their doctor or other healthcare professional for a personal recommendation. It is important to know that any drug can be harmful if used at high doses or very frequently. People with kidney disease should also be sure to avoid drinking alcohol while taking pain medicines. Are NSAIDs safe to take if you have kidney disease? NSAIDs are usually safe for occasional use when taken as directed. However, if your doctor has told you that you have low kidney function, NSAIDs might not be right for you. These medications should only be used under a doctor's care by patients with kidney disease. Also, they might not be the best choice for people with heart disease, high blood pressure, or liver disease. Some of these drugs affect blood pressure control. High doses over a long period of time can also lead to chronic kidney disease and even progress to kidney failure. For people without kidney disease, the recommended dose of aspirin can be safe if you read the label and follow the directions. When taken as directed, regular use of aspirin does not seem to increase the risk of kidney disease in people who have normal kidney function. However, taking doses that are too large, usually more than 6 or 8 tablets a day, may temporarily and possibly permanently reduce kidney function. In people with kidney disease, aspirin may increase the tendency to bleed. 5. Smoking. If you're still puffing away, it's time to kick that habit to the curb. Smoking is a surefire way to damage your kidneys. Quitting isn't easy, but the benefits for your kidneys and your overall health are totally worth it. Smoking can seriously harm the kidneys in a number of ways. It can increase your risk of developing some kidney cancers, damage your heart and blood vessels, cardiovascular system, leading to poor blood flow to the kidneys and causing kidney damage over time. Can smoking affect my kidneys? Yes, for the following reasons. Smoking can affect medicines used to treat high blood pressure. Uncontrolled or poorly controlled high blood pressure is a leading cause of kidney disease. Smoking slows the blood flow to important organs like the kidneys and can make kidney disease worse. Cigarette smoke-induced renal damage is due, at least in part, to activation of the sympathetic nervous system resulting in an elevation in blood pressure. Ethanol, nicotine, or concurrent intake significantly increases lipid peroxidation in liver and decreased superoxide dismutase activity and increased catalase activity in the kidney. This review describes the effects of nicotine, smoking, smoke extracts, and other tobacco constituents on renal and cardiovascular functions and associated effects on the nervous system. Both active and passive smoking is toxic to renal function. 6. Excessive alcohol consumption. Drinking in moderation is the key here. Excessive alcohol can lead to high blood pressure and liver problems, indirectly affecting your kidneys. Stick to recommended alcohol limits and give your kidneys a break. Both acute and chronic alcohol consumption can compromise kidney function, particularly in conjunction with established liver disease. Investigators have observed alcohol-related changes in the structure and function of the kidneys and impairment in their ability to regulate the volume and composition of fluid and electrolytes in the body. Chronic alcoholic patients may experience low blood concentrations of key electrolytes, as well as potentially severe alterations in the body's acid-base balance. In addition, alcohol can disrupt the hormonal control mechanisms that govern kidney function. By promoting liver disease, chronic drinking has further detrimental effects on the kidneys, including impaired sodium and fluid handling and even acute kidney failure. Excessive alcohol consumption can have profound negative effects on the kidneys and their function in maintaining the body's fluid, electrolyte, and acid-base balance, leaving alcoholic people vulnerable to a host of kidney-related health problems. Despite the clinical importance of alcohol's effects on the kidney, however, relatively few recent studies have been conducted to characterize them or elucidate their pathophysiology. It is hoped that future investigations will focus on this important subject area. 7. Ignoring high blood pressure. If you're ignoring your high blood pressure, you're ignoring a red flag for kidney damage. Monitor your blood pressure regularly and follow your doctor's advice on how to keep it in check. Kidney failure. Your kidneys filter out waste from your blood and excess fluid from your body. This comes out of your body as urine. Your kidneys are also largely responsible for balancing the electrolytes, such as sodium and potassium, in your body. If high blood pressure damages the blood vessels of your kidneys, waste and fluid accumulate in your body. If it gets bad enough, you may need a lifetime of dialysis or a kidney transplant. Ignoring high blood pressure can have serious consequences. For a lot of people who don't have other health problems, they feel fine and think they do not need to treat high blood pressure. But sometimes it just takes education on what untreated high blood pressure can do to you over time. With high blood pressure, your heart is beating at a higher resistance, doing more work to pump the same amount of blood. This can cause cardiac remodeling, a heart attack, or a stroke. It could also lead to several small strokes over a period of time because your brain isn't getting the constant blood supply it needs. Untreated high blood pressure can cause the structure of your kidneys to change, leading to kidney failure. When you have high blood pressure, your body tries to preserve the function of your organs. It can affect your blood vessels, eyes, and hormone levels. Over the years, those changes are irreversible. 8. Poorly managed diabetes. Diabetes can be a real kidney knocker. Make sure you're managing your blood sugar levels effectively to protect your kidneys from damage. Regular checkups and a balanced diet can help. How does diabetes cause damage to my kidneys? Diabetes can harm the kidneys by causing damage to blood vessels inside your kidneys. The filtering units of the kidney are filled with tiny blood vessels. Over time, high sugar levels in the blood can cause these vessels to become narrow and clogged. Without enough blood, the kidneys become damaged, and albumin, a type of protein, passes through these filters and ends up in the urine where it should not be. Nerves in your body. Diabetes can also cause damage to the nerves in your body. Nerves carry messages between your brain and all other parts of your body, including your bladder. They let your brain know when your bladder is full. But if the nerves of the bladder are damaged, you may not be able to feel when your bladder is full. The pressure from a full bladder can damage your kidneys. Urinary tract. If urine stays in your bladder for a long time, you may get a urinary tract infection. This is because of bacteria. Bacteria are tiny organisms like germs that can cause disease. They grow rapidly in urine with a high sugar level. Most often these infections affect the bladder, but they can sometimes spread to the kidneys. 9. Skipping. Regular exercise. Hey, couch potatoes, listen up. Exercise is not just for those looking to shed a few pounds, it's also a kidney hero. Get moving regularly to improve your kidney function and overall health. The effects of exercise on kidney function have been studied for more than 3 decades. One of the most common health issues among patients with chronic kidney disease, CKD, is a lack of physical activity, which leads to a low exercise capacity in these patients. The majority of maintenance hemodialysis (MHD) patients do not exercise at all. At each stage of dialysis, patients lose 10-12 gras of their amino acids through blood sampling. Dialysis also leads to increased cortisol and circadian rhythm, sleep disorders in hemodialysis (HD) patients. Studies have also reported higher C-reactive protein levels in HD patients, which causes arterial stiffness. Exercise has a variety of health benefits in these patients, including improved blood pressure control, better sleep, higher physical function, and reduced anxiety and depression. On the other hand, it should be noted that intense exercise has the potential to progress KD, especially when conducted in hot weather with dehydration. This review aimed to investigate the effects of different types of exercise on kidney disease and provide exercise guidelines. To sum up, the majority of previous studies showed that there are beneficial effects of various types of exercise on different kidney diseases, whether during or outside of dialysis session, B. Chronic aerobic, resistance, or combined training, if accompanied by safety considerations, seems to have many benefits for patients with KD, such as improved glomerular filtration, reduced cardiovascular risk factors, increased maximal oxygen uptake, improved muscle protein synthesis, increased or maintained strength, improved body composition, enhanced quality of life, and other health-related factors. C. The type and stage of kidney disease and the patient's condition should be considered prior to prescribing any exercise program. D. On the other hand, in CKD patients, exercise prescription should be based on exercise training principles including individualization, specificity, adaptation, recovery, reversibility, and overload. And E. Exercise load is a combination of the frequency, intensity, and duration of the exercise performed and must be considered for any prescription. 10. Ignoring urinary tract infections, UTIs. UTIs might seem like a minor annoyance, but if left untreated, they can creep up to your kidneys and cause major problems. Pay attention to UTI symptoms and don't hesitate to see a doctor. A urinary tract infection, UTI, is a bacterial infection anywhere in your kidneys, ureters, bladder, or urethra. It's very common, and around 40% of women and 12% of men get at least one UTI in their lifetimes. The primary symptoms of a UTI are pain, a frequent urge to urinate, and a burning sensation with urination. Most UTIs don't pose a serious threat to your health, and mild infections may even clear up without antibiotics. Despite this, you should never ignore UTI symptoms. UTIs can cause a handful of serious complications if the infection starts to spread. The good news is that treating UTIs and lowering your risk of complications is simple and effective. Don't wait to treat a urinary tract infection. It's a wise idea to treat a urinary tract infection as soon as possible. Treatment will improve your quality of life, but also remove the risk of any long-term damage to the urinary tract. If left unchecked, a bacterial infection can spread and damage the surrounding systems. For example, one potential risk is in the kidneys. Due to bacterial buildup, kidneys can get permanently damaged. This is especially of concern for pregnant women suffering from UTIs. Another risk from an untreated UTI is a permanent narrowing of the urethra. This more frequently affects men than women. However, both men and women can develop scarring in the urinary tract as a result of infection. With an untreated UTI, a risk everyone gambles with is bacteria accumulating and entering the bloodstream. If bacteria enters the bloodstream, you can potentially develop sepsis. Sepsis is a life-threatening condition and can cause the shutdown of one or more organ systems. Instead of being limited to the urinary tract, now the entire body is infected. 11. Excessive caffeine consumption. Are you guzzling down too much caffeine from your favorite coffee or energy drinks? Be mindful of your caffeine intake, as it can affect your kidneys. Opt for decaf or herbal teas occasionally. Can you drink coffee with kidney disease? For many people, their daily routine starts with pouring a cup of coffee in the morning. The caffeine in coffee gives us a boost of energy so we can take on the day. If you are living with kidney disease, you may be wondering if coffee is bad for your kidneys and if you can drink coffee with kidney disease. It's true that you'll have to make a few adjustments to what you eat and drink when living with kidney disease to protect your kidney function. However, coffee can be enjoyed in moderation. Being mindful of what you add to your coffee, like cream and sugar, and how much you drink is key to making a kidney-friendly cup of coffee. Is caffeine bad for my kidneys? Caffeine, an active ingredient in coffee, is not inherently bad for you or your kidneys. Researchers have found several benefits of consuming a moderate amount of caffeine. It can help improve your energy levels and boost your metabolism to aid in fat burning, and it is high in antioxidants. Overall, caffeine is not likely to damage your kidneys as long as it is consumed in small doses. It is important to note that caffeine is a stimulant, which can affect some people's blood pressure. If you have high blood pressure or are at risk for high blood pressure, ask your doctor if it's safe for you to have caffeine and/or coffee and how much. The relationship between potassium, coffee, and kidney disease. Potassium is an electrolyte that your body needs to function properly and is found in many foods, including coffee. The challenge when living with kidney disease is that your kidneys aren't able to balance your potassium levels. Therefore, being mindful of how much potassium you consume is important to ensuring your potassium number isn't too high or too low. Since potassium plays a role in keeping your heart healthy, a significant imbalance in your potassium levels can lead to complications with your heart, such as an irregular heartbeat or heart attack. There are about 49 milligrams of potassium in 100 grams of coffee, and 3 cups of coffee is considered high in potassium. If you are going to drink coffee when living with kidney disease, keep track of how much you consume so you can factor that into your daily potassium intake. What you add to your coffee, such as cream or milk, can also increase the potassium content. 12. Poor dietary choices. Lastly, let's talk about diet. Eating junk food all the time can lead to obesity and high blood pressure, both of which are bad news for your kidneys. Instead, aim for a balanced diet rich in fruits, veggies, and lean proteins. Kidney diet. Say no to herbal supplements. Herbal supplements aren't safe if you have kidney disease. Some can hurt your kidneys and even make kidney disease worse. Some vitamins can cause kidney problems too, and should also be avoided. Always talk to your doctor before taking any supplements or vitamins. With a CKD diet, you'll avoid or limit certain foods to protect your kidneys, and you'll include other foods to give you energy and keep you nourished. Your specific diet will depend on whether you're in early stage or late stage CKD or if you're on dialysis. Eat less salt sodium. That's a good move for diabetes and really important for CKD. Over time, your kidneys lose the ability to control your sodium-water balance. Less sodium in your diet will help lower blood pressure and decrease fluid buildup in your body, which is common in kidney disease. Focus on fresh, homemade food and eat only small amounts of restaurant food and packaged food, which usually have lots of sodium. Look for low sodium, 5% or less, on food labels. In a week or two, you'll get used to less salt in your food, especially if you dial up the flavor with herbs, spices, mustard, and flavored vinegars. But don't use salt substitutes unless your doctor or dietitian says you can. Many are very high in potassium, which you may need to limit. Depending on your stage of kidney disease, you may also need to reduce the potassium, phosphorus, and protein in your diet. Many foods that are part of a typical healthy diet may not be right for a CKD diet. Phosphorus is a mineral that keeps your bones strong and other parts of your body healthy. Your kidneys can't remove extra phosphorus from your blood very well. Too much weakens bones and can damage your blood vessels, eyes, and heart. Meat, dairy, beans, nuts, whole grain bread, and dark-colored sodas are high in phosphorus. Phosphorus is also added to lots of packaged foods. The right level of potassium keeps your nerves and muscles working well. With CKD, too much potassium can build up in your blood and cause serious heart problems. Oranges, potatoes, tomatoes, whole grain bread, and many other foods are high in potassium. Apples, carrots, and white bread are lower in potassium. Your doctor may prescribe a potassium binder, a medicine that helps your body get rid of extra potassium. Eat the right amount of protein. More protein than you need makes your kidneys work harder and may make CKD worse. But too little isn't healthy either. Both animal and plant foods have protein. Your dietitian can help you figure out the right combination and amount of protein to eat. Diabetes and CKD foods. Your dietitian can give you lots of tasty ideas for healthy meals. Below are just a few examples of foods a person with both diabetes and CKD can eat. Your dietitian can give you lots more suggestions and help you find recipes for tasty meals. Fruits, berries, grapes, cherries, apples, plums, veggies, cauliflower, onions, eggplant, turnips. Proteins: lean meats, poultry, fish, eggs, unsalted seafood. Carbs: white bread, bagels, sandwich buns, unsalted crackers, pasta. Drinks: water, clear diet sodas, unsweetened tea. Here's one way your CKD diet and diabetes diet can work together. If you drink orange juice to treat low blood sugar, switch to kidney-friendly apple or grape juice. You'll get the same blood sugar boost with a lot less potassium. Conclusion: there you have it, folks. 12 bad habits that can silently harm your kidneys. But the good news is, with a few lifestyle changes, you can protect these vital organs and enjoy a healthier life. So, keep those kidneys smiling by making wise choices, staying hydrated, and consulting your healthcare professional when needed. Your body will thank you for it.